Welcome to this recorded discussion on elements of Ohio's Issue 1, the right to reproductive freedom with protection for health and safety. I'm the facilitator, Jane Wheaton, a member of the League of Women Voters. I'm a retired perinatal nurse specialist. There is much disinformation about this issue. We have asked a local OB/GYN physician expert to provide us with nonpartisan facts about abortion care as it relates to Ohio's Issue 1.
Hello, I'm Dr. Minnie Somasundaram. I've been practicing obstetrics and gynecology in Columbus, Ohio since 2003. I currently specialize in minimally invasive gynecology and focus on robotic surgery to help women with women's health issues.
Well, we're so glad that you're giving us your time for this today. So question 1 is, what happens to abortion care in Ohio if the majority of voters vote yes and Issue 1 passes?
In reality, it won't change immediately as much as we would anticipate, as many abortion clinics have already been closed for several years. What will improve is that physicians will not have to choose between caring for their patients and losing their licenses or being penalized for providing reproductive care.
Thank you. What about teens, may I ask, in relation to that, and parental rights?
I think that's some of the misinformation that's currently permeating throughout the media and social media. Nothing would change about parental rights.
What changes might occur if abortion care in Ohio and the voters vote no and Issue 1 does not pass?
This is actually much more dramatic from the standpoint of the fact that Governor DeWine signed the heartbeat bill into law in 2019, but it had a federal injunction against it, which allowed abortion care to continue to be provided up until 22 weeks. Unfortunately, if Issue 1 fails, the heartbeat bill will probably go into effect and patients will be forced to travel out of state to access care. The heartbeat bill makes abortion illegal after 6 weeks. So this would delay care and threaten the health of the patient, as patients often don't know that they're pregnant prior to that. 6 weeks is essentially when we would start to see the flicker of a heartbeat on ultrasound. And it is oftentimes early as to when women identify whether they're pregnant or not.
Thank you. That leads us to the next question so that we can clarify, why did supporters of Issue 1 include protection for miscarriage care? And what does that have to do with abortion care?
Miscarriage is a non-medical term for abortion. And if Issue 1 fails, some patients may not get the care they need because providers use the same procedures and medications to treat miscarriages, or what we would call incomplete abortions, that are used to treat elective abortions. And these would be illegal. So the physician might be afraid to take care of a patient who is clearly bleeding and early in the process of miscarrying, as we've seen in other states.
Okay, thank you. So then how common or uncommon is post-viability pregnancy termination, and why would that be performed?
And this is a very good question because I think there's a lot of misinformation around this. Less than 1% of terminations happen after 21 weeks. You have to remember, the women who are experiencing this in that 1% are women who were looking forward to the pregnancy. They may have picked out a room, picked out like clothes, and they have received devastating medical information that has led them to need to decide on this, that 1%. And I think that's the struggle that we're facing as docs, as physicians, is that caring for patients becomes enmeshed in legalese that isn't reflective of the medical component of the care.
Thank you. So our final question for you is to talk about the role of the OB/GYN physician and the impact of a pass or fail of Issue 1.
OB/GYNs, like other physicians, take an oath to do no harm. And when there's a conflict between duty and law, it can create a lot of emotional stress for the physicians and create inadequate care and harmful care for the patient. Because as the physician grapples with what the right decision is and to avoid potential prosecution and felony charges, they struggle with those decisions. So if issue 1 passes, OBGYNs can continue to provide evidence-based care for their patients, and they can recruit additional generations of physicians to practice in Ohio. If issue 1 fails, it will become increasingly difficult to provide comprehensive care and attract new physicians in any specialty, as young physicians are often at the peak of their own reproductive years. So physicians will then consider where do they want to practice, because they will be encumbered by the same laws that their patients are experiencing. Other states' restrictions have lost maternity hospitals and have become maternity deserts. And patients with decreased access are finding that their reproductive access, even to like pap smears, preventative care, contraception, has diminished.
Thank you very much. That ends our questions on this topic, as we're seeking to get some facts and the science about this issue. So I really appreciate your time and your expert information provided to us today. Thank you very much.
Absolutely. Thank you for having me answer these questions for you.
The League of Women Voters seeks to empower voters to make informed decisions. To learn more about issue 1, please review the web resource listed on this slide. And please vote early at your local board of election, or vote on election day, November 7th.